Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
I thought we'd take a quick look at autism since it's so pervasive and just give an overview of some of the reasons why we see it and some of the underlying conditions that are suggested. Well, first, there is a genetic component associated with autism risk. Having a family history of autism does increase the likelihood of developing that particular condition. We also see an increase when we see advanced parental age, maternal exposure also, medications, infections during pregnancy, and even maternal obesity has been suggested. Low birth weight, premature birth, and lack of oxygen during delivery have also been implicated for an increased risk of autism. And even exposure to air pollution, pesticides, toxic metals, and gestational diabetes and autoimmune disorders have also been associated to some degree with an increased risk. Now, autism occurs in boys as much as 4 times more than girls. We also find the parent's socioeconomic status has a either decreased or increased risk associated with it. But there's something that needs to be looked at that doesn't make well sense. In 1970, autism rates were 1 in 10,000. By 2006, it was 1 in 110. And by 2021, it was 1 in 44. In literally 50 years, it went from 1 in 10,000 to 1 in 44. Excuse me, what is the etiology? What could possibly be the cause? Now, we're given the excuse typically that diagnostic changes, increased awareness, improved diagnostic procedures, changes in reporting and data collection, and even environmental factors were part of that reason why that autism rate has increased. No talk of toxic metals, particularly in any of the vaccines, etc., although they have supposedly been debunked by our conventional type of things, but there are some question marks that we have to think about. How do we explain, because the other things they say, do we explain the presence or lack of presence in the older population of this country, like folks in their 40s and 50s, 60s, and 70s? This condition is rare. In 44 years of practice, I can't remember seeing, diagnosing, or treating any of this age group for autism. And I always ask pretty much the same question when I see a patient. In this case, I'm going to ask the same question. And perhaps you might have an answer from your research, and that is why? Why are we seeing none or very little as clinicians of autism if it's truly just the reporting and better diagnostic procedures? Why aren't we seeing it in the elderly population? I guess it would be I'm Dr. Mitch, and for further information, please feel free to contact me at drmitchghen.com. That's drmitch.com. Thank you so much for watching.